To the members of the 2009 Inman Abbott Conference at UCSF, greetings from Kabul. As-salam alaikum. It is my pleasure to be speaking to you today from my office here in Afghanistan, where I've been working as an orthopedic surgery advisor and mentor over the past 8 months. I started my active duty service in the Navy after the completion of my residency at UCSF. Soon after I reported to my first duty station, I volunteered to be deployed overseas in support of Operation Enduring Freedom. Fortunately for me, this meant becoming part of the Combined Security Transition Command, which is the international military organization responsible for rebuilding the Afghan National Army and National Police Forces. Part of this rebuilding mission is the rejuvenation of the National Army and National Police hospital systems. These hospitals, like all other hospitals in Afghanistan, have suffered through a long 30-year period of war and civil unrest, starting with the Soviet occupation in the 1980s, followed by the Mujahideen Civil War in the early 90s, and finally Taliban rule in the late 90s through 2001. This period of conflict and strife has had profound negative effects on the economic, education, and healthcare systems in this country. As a result, the standard of healthcare here in Afghanistan is extremely low, even when compared with other developing nations. I work primarily at the Afghan National Military Hospital, or NMH as we call it, which is the largest hospital here in Afghanistan. The NMH is truly a general hospital, serving both military and civilian patients. The average daily patient census on the orthopedic surgery ward is between 60 and 70 patients, half of which are military and half of which are civilian. The majority of cases treated here are trauma-related, but the surgeons of the ortho department have a general practice treating the entire spectrum of musculoskeletal disease. My daily activities include consultation and teaching on orthopedic surgery ward rounds, supervision and participation in surgical care in the operating room, regular didactic lectures for the orthopedic staff, and work with the department leaders in program development projects. I also work to equip the National Hospital and other hospitals around the country with basic orthopedic surgery implants and instruments. My experience working with the Afghan orthopedic surgeons has been truly rewarding. I have found them to be welcoming, hardworking, dedicated, intelligent, capable, and enthusiastic. They truly are a remarkable group of individuals, especially considering the hardships and low standard of living here in Afghanistan. With these individuals in mind, the focus of my mentoring efforts here has been education, especially of the younger generation of surgeons with whom I work. Education is truly the core of sustainable medical assistance efforts in developing nations. It is only by training surgeons of the future that we can empower them to make changes and improvements in their own systems. To this effort, I am grateful for my connections and relationships with UCSF and San Francisco General Hospital, including the friendship of Dr. Coughlin, Dr. Jurgensen, and all the surgeons in the UCSF orthopedic surgery community. This past winter, we exchanged memorandums of understanding between UCSF and the NMH orthopedic surgery departments, with UCSF pledging support for programs in project development, education, and research. I'd like to publicly thank both Dr. Vale and Dr. Miklau for their leadership and support in this effort. Organizations like the Institute for Global Orthopaedics and Traumatology, or IGOT, at UCSF are at the forefront of international medicine. It is through relationships such as this that we can make sustainable and real improvements in orthopedic and trauma care for people around the world. I look forward to continuing my work here in Afghanistan even after I return home to the U.S. as a result of IGOT. Therefore, I encourage all the members of the Abbott Society to support and participate in IGOT-sponsored projects around the globe. I am proud to be associated with the physicians of UCSF who are working to bring positive change to the hospitals and people around the world who truly need and deserve it. Thank you, and have a great day.